We are experiencing a period of time where conflicts last longer, the impacts on communities and affected populations are greater and over a longer period of time. The challenges of access become not just theoretical, but life-threatening.
In 2019, nearly 132 million people will need humanitarian assistance. About 3/4 of them live in conflict areas.
We're in a moment in history in which the humanitarian demand is at an unprecedented historic height. And that's a function of the proliferation of armed conflicts, the massive and sudden escalation of displacement of populations.
The problem is only getting worse, and access to aid is routinely blocked to those who need it most.
Access is blocked both by sovereign nations as well as non-state actors or some combination of the two, or because of sanctions levied by the U.S. So the complexity around access is really a critical issue.
The right to humanitarian assistance is guaranteed by international law. Yet, access is denied, delayed, or diverted by states and armed groups. Targeted attacks on infrastructure, schools, and hospitals create obstacles for reaching life-saving assistance. Syria has been the deadliest country for aid workers. In 2018, more than 75 health workers were killed.
The international laws that governments have signed up to have never been so openly flouted. It is almost a deliberate political approach now to be counter-humanitarian, to subsume the lives of human beings underneath political and military aspirations. And while that's always been present, it's never been so overt.
In other conflicts, governments use bureaucratic delays to block access.
There are governments that refuse to offer visas or that delay for a really long time offering visas or that just sort of put up other bureaucratic impediments that either significantly delay or in some cases just make it impossible to reach populations.
South Sudan's government, for example, has tried to financially exploit international aid efforts. Even well-meaning actors such as donors and the UN contribute to these challenges. Broad counter-terror restrictions often force humanitarian organizations to limit their work out of fear of prosecution.
The unintended consequences of counterterrorism national security policies, which are essential, is raising the costs for the NGOs that are working in humanitarian issues. It's putting them at a risk of liability under U.S. law.
All humanitarian access constraints undermine the efforts of the United States, the largest single humanitarian donor in the world.
So I believe that the United States plays a pivotal and probably the most central role in issues of humanitarian aid in conflicted environments and humanitarian access. We, of course, are the biggest funders of organizations that work in conflicted environments.
The CSIS Task Force on Humanitarian Access has identified 4 steps the U.S. can take in improving humanitarian access. 1. Elevate humanitarian issues as a top priority in its national security strategy. 2. Strike a new balance. Ensure cooperation with national security and humanitarian interests.
I think it is more important than ever that we develop a robust dialogue across our national security community that would include those who work counterterrorism issues and those who are involved in delivering humanitarian assistance so that we can both meet our counterterrorism objectives and serve those vulnerable populations that we need to access to deliver humanitarian aid.
3. Improve data collection on access denial. Provide detailed reporting on violations. And, ultimately, hold violators accountable. 4. Improve humanitarian worker training and fund technological innovation. Humanitarian access is a political problem and requires political solutions. U.S. leaders have a critical role to play in this.
U.S. leadership in the international community makes a difference. It often makes the essential difference.